Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now you literally have gone through everything. You've been in pain from the neck going all the way down into the low back, seizures. That I know you said you actually had one, was it last weekend?
Actually, a couple days ago.
Still has a hospital band on. So I had a seizure a couple days ago. You were telling me about a story with the low back and completely just with mopping and felt a little bit of pain. A couple minutes later, couldn't even stand up. Medical doctors found nothing. When they were in there, took x-rays, took films, did not have an explanation on why you were experiencing as much pain as you were.
None whatsoever.
Okay, now today you've got, I'll have you tell everybody just kind of what's going on.
Today I have complete pain all through the lower back to the mid-spine and in between my shoulder blades also.
Okay. Alright, so everything just kind of middle, lower. So we're going to work on everything today. We're going to do that full body adjustment. Now, is this the first time ever going to a chiropractor?
I kind of went to a chiropractor when I was younger through I guess you would call an accident.
Okay.
I went and saw them for about a month, but
Don't
didn't
really
stay long.
Okay. Okay. So this is the, well, today will be the first time getting that Y-strap done.
That is true.
Alright, so what I want to do, I want to get a baseline, kind of see where you're at, and we're going to put you through some ranges of motion, through some orthopedic tests. I'm trying to kind of provoke a little bit of pain. Let me know if you do experience anything, and I'll stop. I'm not trying to torture you by all means, but alright, let's go ahead and get started. Easy as looking up at the ceiling. Any pain when doing that?
The middle back.
The middle back?
Lower back.
Okay, right in here?
Exactly.
Okay. And then if you were to look all the way down at the ground, any issues with that?
Same area. Feels like the whole spine is being stretched in the middle.
Okay. If you were to bring one ear to a shoulder and then to the other, any pain with that?
Tightness right here.
Okay. And what about the other side?
Over here.
Over there? Okay. And then if you were to rotate and look over either shoulder, any issues with that?
Same spot along the right hand side.
Along that right side? Okay. I'm going to have you sit up nice and straight for me. I'm going to push down on the top of your head. Any pain when doing that?
Evenly.
Evenly? Okay. We're going to have you turn your head to this side. Any pain with that?
No.
Okay. And then to the other. Any pain with that?
Minus the skull? No.
Okay, good. Alrighty. Well, now what I want you to do, I want you to stand up for me.
Okay.
And if you're to bend forward at the waist,
Hands here.
doesn't matter. You can keep them there. Any pain with that?
Same spot along the
Along that, okay.
spine here.
And then if you're to come back, lean back a little bit. Any pain with that? No?
Not really.
Okay. If you're to come down your leg to one side, any issues with that? And then to the other side,
Just tightness.
just tightness. And then if you're to rotate over either side, any pain with that? Just
Same right spine. Feels like they're kind of like grinding.
okay. All right. So a lot of that mid back is really the okay. Yeah, that's what with doing these tests, it really kind of pinpointed that mid back area. All right. So what I'm going to have you do, I'm going to have you lay face down for me.
Okay.
We're going to scan the entire body, check the right side to the left side, and do some nice comparison here. Okay. Yep, perfect. All right, so yeah, like I just said, we're going to scan the entire body. We're looking for any tight, taut, tender fibers. Now, granted, his mid-back, all right in through here, actually on both sides, very tight here. So we're going to do a lot of the massage device so you can relax a lot of those areas. But what we're going to do, we're going to start up here in the neck. Now I'm going to palpate, so I'm going to push into the spine and be feeling. Now let me know if any of this is tender to the touch, okay?
Okay.
So we start in that cervical spine, Going to the thoracic. Okay, how's that feeling?
Good.
Okay, good. All right, from the thoracic, from that middle back, now we're kind of getting into that lower middle back. Now here's where these muscles are starting to get real tight on through here.
Yeah.
Any pain in this area?
Not real pain, but it just feels tight.
Okay. Okay, now into that lumbar spine. Okay. Any issues when I push in over the right SI joint?
No.
Good. What about over the sacrum? A little bit? Okay. And now we're going to do the left SI joint. Any pain with that?
No.
Good. Okay, so we're going to come down here. We are going to check the leg length out. So when we push in, just slight bit short on the left here. It's not even much, but just a tiny bit noticeable. So we're going to make sure and keep checking that out throughout the adjustments. So like I said, now what I'm going to do, we're going to do the massage device. We're going to start it up and through here and bring it through that middle back. Sound good?
Not a problem. It was sending a tingling spine, feeling all down the right side.
All down that right side?
And you hit it right in here.
Okay. Okay, so yeah, he was saying he was feeling a tingling going into the right side as we were doing that massage device right through here. Now that right side, the reason I kind of stayed on that a little bit more is when I was kind of in this area, I really start to feel that muscle was tensed up. It was real taut and real hyper, so we want to really kind of work on that area as well. But like I start every adjustment, I like to start at that cervical thoracic junction here. I like to really open up the nerves and take pressure off those nerves in this area. So we're going to start on that left side right here. We're going to do a T2 on the left. Good. Got a T1 on the right here. Okay. Now we're going to come right in through that upper thoracic spine here. I'm going to have you take a deep breath in and exhale out. Okay, we're going to drop down a little bit. Deep breath in and exhale out. Okay. So in his case right now, just because everything is really tight, he's not wanting to move that well in the prone position, so that's why I do that standing intercostal adjustment, and that's why we do the anterior or that supine adjustment. But from that T2 and T1 adjustment up top, let's see if there's any change in the leg length. So still, I mean, it's almost exactly balanced, which is a good thing. But let's come down here. I want to check to see if there's any imbalances in the sacrum. So we're going to stabilize right here. I want you to raise this right leg up as high as you can. Any pain, tenderness, tightness with that? Good. And raise the left side up for me. Any pain, tenderness, tightness with that? Good. Yeah, both went up actually really well there, which is a good thing. But, so right in through here, what we're going to have you do, I want you to sit up and straddle the table. One leg on either side. Yep.
Both?
Yep, just like that. So I'm going to come right from behind here. We're going to have you put this arm over, that arm over. Okay. So with your legs, I want you to keep your legs to the table. I'm going to turn you like this. And I want you to look as far as you can over the shoulder. Good. There we go. That was that spot that really was just kind of causing issues, and you're even feeling that tingling coming from there, kind of going on that right side. So that was a good one to get released for you.
Yeah. That was more in the lower.
Was it?
Yeah.
Yeah, a little bit more on the lower? Okay. So we're going to come up right here, and that I'm noticing on the left side. We're going to rotate you, keep the thighs to the table. Good. And relax. Perfect. Okay. Got great movement there. Lay face down again for me. Want to recheck those leg length? Okay. So getting that spine straightened out. So yep, still the same how we're looking. He's still staying balanced throughout this entire thing. We can push in as much as we want. As you can tell, he's staying very balanced there. But a lot of his chief complaint has been right in through that middle of the back here. So now we're going to do a supine adjustment here. Okay, so with this one, I want you to take a deep breath in and exhale out. Breathe all the way out, all the way out. Good. Now come up just a little bit. Right there, one more time, deep breath in and let it out. Good. Alright, so I want you to relax just like that in that position. So now we're going to do that Y-strap today. Now this is where you're going to get that decompression, and this one's really just going to release, especially in that mid-back for you.
That's what is needed.
Alright, I'm going to have you lift your head up. Good, and relax. Okay. There we go. And relax for me. How'd that feel?
Good. Now that pulled apart the whole upper back.
You felt how that?
From the mid, pretty much right here.
Good. Yeah. So with that, just because even how things are that locked up, we got to get those muscles to just let go just a little bit. So what I'm going to have you do, I want you to sit up for me. Good. Yeah, you felt that go in right in through here? Mm-hmm. Okay. Good, good, good. Okay, what I'm going to do, I'm going to have you just sit and face that way. I'm going to use the massage device. We're going to go at that middle to lower back for you, okay?
Not a problem.
Yeah, I was actually, in the beginning, I was really noticing it's still very tight. Towards the end, we were able to get that loosened up a little bit more. But yeah, everything right in this area is very just kind of tense and very tight right through there. So that's one thing always to kind of like keep aware of. I know one thing that will help, especially when you are sitting, make sure to have some type of, like a little bit of a lumbar support. Yep.
Okay.
Even if it's as simple as if you're on the couch and just having a pillow in the low back, just something to really kind of get that arch back and that lower spine there. That you'll start to notice quite a bit of a difference. Or even same thing like when you're driving too. Same thing with that lumbar spine there, okay? Alright, what I want to do, just because we got that to loosen up a little bit more, I'm going to have you turn and face that way for me. Okay. Let me do that Y-strap here. Get as much tension and decompress the spine here. Have you lean back. Good. And just relax. There we go.
And that one was more for lower.
Yeah, do you see, so that time, everything, those muscles were just real locked up. So we really just had to spend a little bit more time, a little bit more TLC, kind of just loosen that up, just so we could get as far as you can with that Y-strap. Now, if you were to describe that, and getting that adjustment done, to anybody out there in the world, how would you tell them? How would you describe it?
I feel like I grew an inch.
A lot of people say that. Yeah, you just feeling taller now. I'm not gonna lie. I would love to take that inch from you. I think I could use it a little bit more than you. But yes, yeah. Have you come on up? Now, when you first came in, things were a little tight, looking down, looking out, kind of moving around. How are things? Move around a little bit for me. Do you notice a difference after the adjustment?
I can move more.
Good.
Doesn't hurt as bad.
Doesn't hurt as bad, can move more, and that's even just that one adjustment. Now you've been having pain, as you told me when you walked in, you've had back pain your entire life, as much.
Pretty much.
Pretty much.
Mm.
So, I mean, just getting any type of relief, lowering that, is a good thing. So that was one adjustment.
That it definitely did.
Yeah. So with one adjustment, we're able to get that much lowered. Now, typically how I kind of set up plans around here is I like people coming in, at least once a month. Granted, you know your body better than anybody. So you'll know, when the effects, when the adjustment starts kind of going away, you'll know, okay, kind of, need to get back in, get that, realigned.
I need a new bed.
But yeah, a lot of people look at that one too. But yeah, I'm telling you, you'll start to notice a difference, getting a little bit more lumbar support when you're sitting and when you're driving. Have something back there, like I said, a pillow, or you can get it like on Amazon. You can find those like lumbar supports to put in like the car. Those will be good. That'll help. But yeah, then also when you do start noticing a little bit increased pain again, send me a text. We'll get you back on in here. So.
Sounds like a plan.
Perfect. You're welcome. So if anyone's looking to get an adjustment, just go right to the website, drjosephcipriano.com. Send me a message and hope to get you in here soon.
That we do.
Have a good one, everybody.
Nice meeting you.
You too.